Good morning. This is Dr. Joe Adeboyega. I would like to have a short conversation with regard to the supervision session of April 29th, 2022. We discussed the issue of transference and counter-transference. This is very important for therapists to know themselves and try to endeavor not to allow themselves to uh, uh, fall into that trap of transference and counter-transference. Transference to be defined in this way is to be defined this way. The patient is looking up to you for help as an individual. And that patient must not start to feel like in the way you interact with that patient, like you are now acting like their father, their mother, or their pastor, or even their nagging partner at home. You should be independent and objective enough to listen to that individual and not make him or her feel like you are acting like those back home or those in his or her environment that might be actually contributing to the mental illness, stress, or the PTSD they might have endured. So, and for the counter-transference, it is the therapist now that is looking at the patient as if that patient is like her son, like ex-husband, or brother, or a dad. So we have to be able to stay out of it. In the helping business, we have to be able to help people as individual, meet them where they are without dictating to them what kind of religion they have to practice. We can make suggestions of things that they need to do to improve their life. First is to listen and not be judgmental. Okay? Maybe your religion says you shouldn't drink or shouldn't smoke marijuana. That is good for you. But the patient might be from a different cultural background where smoking marijuana is not as bad as you using pain pills or drinking alcohol. So you have to meet the patient where they are. A typical example is the case of a lady that worked with me at the methadone clinic. Whenever the patient was doing good, she was very happy. It was almost like her daughter or her son was doing good. Whenever they relapsed, she would take it so personal, almost like a mother now mad at her son or her daughter for failing to make progress. And I will have to explain to her that, listen, you are helping them, but if you start to transform yourself into the parent at home that is nagging them, or partner at home that is nagging them, or sister, then you fail in your effort to help them. And when you suspect that you might not be able to be objective and honest and be able to listen to the patient, then you might even do more harm than anything. So we had a case of the daughter of a pastor, and the pastor's insistence on the fact that the counseling should be done in a Christian manner actually, and then his involvement in his attempt to be involved in every aspect of the therapy for a young adult. This is not a 6-year-old child. I had to close the case. I have to close the case and send the child somewhere else. I suspected there was issue of abuse there. Abuse, it might not be sexual, but just emotional, because that girl was growing up in a religious home where certain rules that might be so stringent that it drives some young people crazy. A child has to be able to live their life. And particularly with someone like me, I'm from an African background where the tendency is to follow tradition, stupid traditions sometimes, where you have to listen to your dad or your mom. Your dad might be a stupid idiot or just like your mom. But if you are smarter than them and you know what you want to do in life, you should be free to follow your own heart. And that is what I encourage. That is how I run my own life. I might listen to people, but I follow my own heart. And that is why I'm here today, instead of being in my hometown, back in Nigeria. Okay? Because left to my parents, they would want me to be back home. They would have preferred that I was back home in Nigeria. but I never followed their advice. I listened to them, but I never followed their advice. So if you are counseling me, like my uncle was trying to counsel me, trying to kind of encourage me to follow that stupid tradition of you have to listen to your parents. Yeah, you see where Africa is today? All the leaders are bunch of, not all of them, but many of them are bunch of people that you shouldn't follow their example. So I am not the type that will encourage people to follow the elders. The elders are stupid. You don't have to be stupid like them. You don't have to follow them. You don't have to be like a sheep following them. Okay? So as a therapist, I am there to listen to the patient and trying to figure out how I can help them. I have to thoroughly ignore all those cultural bullshit, cultural things where you have to do this, you have to do that. No, I want to see how can I figure out how to help these people, this person, to stop doing what they are doing that is detrimental to their life. And then we can move on from there. So this is just what I explained to my supervisors yesterday on April 29, 2022. And some of them who were not able to attend or attend fully wanted me to have a video that they can go to watch so that they have a good understanding of what we discussed. Thank you very much for listening. Bye.